Good morning. Today is Saturday, March 14th, 2020, and I teach a class at 9:30 at Sattic Space Yoga and Healing Studio. With this fear of coronavirus, most of us are self-quarantined. So we have decided to do a Facebook live broadcast of my teaching from my home. And I encourage all the participants to listen to it, make a comment. If you have any question, it will be like a interactive session as like regular in the class. So with this day of technology, it is so important that we follow the guidelines and also we take care of ourselves. So today, I was thinking that I will do a class primarily for a pranayama practice, which all of you know from yogic standpoint. It's the healing power. A pranayama practice for improving your lung health and immunity to fight against this spreading coronavirus. Now, all of you know by now, the coronavirus is a same class as like a flu virus. Its spread is through the droplet. So we discussed all the time about social distancing, not the social isolation, social distancing. And the way we are talking about, if you're in public, so if you put your hands high up, this is almost 3 feet. And if the other person puts the hand high up, it will be 3 feet. It will be 6 feet. So 6 feet distance is good enough for the droplets to drop down on the ground. And this virus doesn't last too long on the ground. So if you practice a good hygiene and a little social distancing, you are able to control the spread of this virus. From the yogic standpoint, let's see what we are doing to improve our health and healing to fight against coronavirus. See, for us, we do a daily yogic routine. We call it dinacharya, daily routine. So let me go over with you in the steps. First thing, we wake up, we sit down in a squatting pose called a malasana, and we drink a comfortable glass or glass and a half of just water at the room temperature. Sitting down in that squatting pose, it relaxes your pelvic sphincters, it starts the gastrocolic reflex, and within a short time, you have a good elimination, good bowel movement. So in yogic tradition or yogic philosophy, health is defined as a strong digestion, easy elimination, and good night's sleep. So with a proper easy elimination, you are bringing a health and healing and able to improve your immunity. Next, we brush our teeth And during brushing our teeth, we also massage the gums. The gum is a site for infection. All the bacteria resides in the gum, called gingivitis. So by massaging, we are helping eliminate the infective process, or maybe some virus which is still lodged in your mouth because what you are inhaling in public places. Very important yogic practice, massaging your gum with your finger. Next, after brushing, we do tongue scraping. And tongue scraping probably removes any of the droplets which we have. In fact, one of our recommendations also is your drinking small amount of warm water to sort of flush the droplets which are sitting on your tongue and the mouth. So tongue scraping is another very good yogic practice. Next we do is jal neti, called neti pot. We take a little neti pot, put a little lukewarm water. We use some salt, which is a non-iodized salt. We put it through one nostril, keep our eyes closed, slowly breathe through your mouth, and the water comes out from the other nostril. We flush both the nostril, then we repeat in the other side, using the same neti pot, same amount of water. So this is not that we do during the time of this coronavirus outbreak or a flu season. We do it all the time. This is a part of our daily routine, dinacharya. And for myself, I've been doing it for years and years and years, and I never miss. Doesn't matter where I am. I'm in the plane, I'm in the train, I'm in a hotel. I never missed a jal neti or washing my nostril any time at the present living. And the concept here is I wash my face, wash my eyes, wash my hair. Why not the nose? This is through which I'm breathing my prana, my oxygen, and improving my lung function, and I do it all the time. This also does another effect. It removes your irritation. Initially, a jal neti or neti pot using causes a tremendous amount of irritation. Your face gets flushed, your eye starts watering, but slowly and slowly, body starts the homeostatic process. Slowly, neuroplasticity sets in. You don't get any more irritation. You stay calm. So basically, what I'm trying to say, this creates a state at which you stay calm in the middle of crisis. The panic of the coronavirus is more than the coronavirus itself. I'm not saying it's not doing it, it's doing a tremendous amount of destruction to our health, our community, our economy, but the fear. And next is the isolation depression. We're all isolated, we are all developing depression. So having a live conversation with you, even from home, through the present day technology, is almost as good as like handling or tackling the coronavirus. We do a lot of other practices which are very beneficial for our health and healing. Another one we do most of the time, we do call it abhyanga, self-oleation. Put oil in our body and then followed by a steam box called swadhana or a little bit of a hot shower. And we know the physiological effect of them, which are very effective in creating what we call the salutogenesis. It's a new term. Salute means health in Latin, and genesis is a Greek called origin, like origin of health. Like we are having a health to fight the coronavirus. The most important effect of coronavirus is in the lung. It primarily affects your lung. So remember one thing, virus cannot multiply on its own. Virus only multiply when they have a host. So when they have a host, there is a whole mechanism which I'm not going to go through, but just understand the virus has to be in your body to multiply. And for the coronavirus at this time, is a human being is the most important carrier. So it starts creating an inflammation in the lung, and if it is localized in the lung, generally it can cause a complete resolution or called pulmonary fibrosis. Pulmonary fibrosis is basically, you can think about, it's called scar tissue of the lung. So the exchange of oxygen and exchange of carbon dioxide is not being done properly, and slowly you get hypoxic. That means you start having a reduced oxygen in your body. If your body immunity is down, or if you have other medical problem, then the lung infection can become very severe to the point it can cause a septicemia. That means the infection going into the blood. Then it can create a state, it's called a septic shock. Septic shock is one of the outcome of septicemia. And in the septic shock, that creates a called multiple organ failure. So when the lung starts to fail, we generally support them with the intubation and respirator. Next thing fails is a kidney. When kidney starts failing, we can support with a dialysis, temporary dialysis. Then starts failing is the liver. When the liver starts to fail, almost always it becomes almost a terminal event. So most of the death which I've seen by now from coronavirus is the elderly person with a underlying cardiopulmonary condition or underlying chronic medical condition, and the terminal event is primarily the multiple organ failure. So for us, what you can do, after this yogic practice of morning called Ushapan, drinking water, proper elimination, scraping of the tongue, doing a jalneti, massaging your gum, doing the abhyangam, doliation, the steam box, and a daily shower. Then we start doing some yoga practice, which primarily is for us for the asana, the poses, pranayama, the breathing, and the meditation. Our rule of thumb primarily is 25 minutes of asanas, 25 minutes of pranayama, and 10 minutes of meditation. That's about an hour practice. Pranayama is the therapy for improving your lung health and improving your immunity. But for pranayama, the breathing technique is through the muscles of respiration. So if you look at the muscles of respiration, they are all called skeletal muscles. And the muscles of respiration, if you look at the anatomy, it attaches from your chest and the back area towards your upper part of your body. Like we call it the upper extremities. So the muscles are attached to the upper extremities and the muscles are very tight. So your effortless breathing doesn't take place unless you start relaxing your physical body. Physical body has to be relaxed. So first you will start relaxing your upper part of the body, lower part of the body, total body. Then you will be able to see that how you can improve your pulmonary function. And the best way to do a pulmonary function is your thought process. Lung is like a balloon. It has a 4-liter capacity and we only breathe 500 cc. So you will learn how to breathe out first. That is the first yogic breathing. Once you breathe out first, you create a space in the lung. Then you take a deep breath in effortlessly and you breathe out longer than breathing in. When you breathe out longer than breathing in, what you do, you create a more space. So when you're relaxed, you can breathe in a little bit more and more and more amount of air in. Like more oxygen will come in. Eventually, when you're properly relaxed, you will see you'll be able to breathe in almost twice, 3 times. We can do almost 4 times than what we normally breathe in. So let's start a practice. If you're at home, sitting or you're watching, the first we start with our hands. We call it a Balo Mushti Mudra. Balo Mushti Mudra or Adhi Mudra. It's like a baby fist. Why? The babies do everything what yogis do. Babies are completely relaxed. Baby has their body and mind totally connected. So a baby will take the hand, they take the thumb inside and close. This is called baby fist, Balo Mushti Mudra. This relaxes your hand. In fact, we recommend this for people who has a pain in the hand from arthritis or other condition throughout the whole day. So when we practice in the morning, generally we do it with our breathing. So you can put your hands in the front, you can breathe out first, take a deep breath in, and when you breathe out, you do the Adhi Mudra or baby fist or called a Balo Mushti Mudra. Breathe in, breathe out. Do it a few times. Then you start with the eyes closed. This is a very powerful yogic phenomena. It's called Pratyahara. Pratyahara is the 5th limb of 8-limb practice of yoga. In a Pratyahara, you learn how to control your senses. So the controlling of the senses brings a profound level of relaxation. Wrist gets relaxed with extension. Breathe in, breathe out. With the breathing, breathe in, breathe out. Breathe in, breathe out. When our wrists are relaxed, you will be able to see something very interesting. I don't know if you can see from there, but here I can put my wrist and I am following my body signal. What is my body signal? Is pain. If I feel any pain, I back off. But I stay in that posture as long as I can. Next, my effect is your effortless breathing. If my breathing is effortless, my physical body has no imbalance. If you have an imbalance in the physical body, it affects in your breath. Why? This is called Panchakosha model, 5 koshas. Annamaya kosha to pranamaya kosha. Any imbalance you create in your physical body shows up in your breath. So I don't have any pain in my wrist. My breath is effortless. And effortless breathing means I can talk, I can breathe, I can even sing when I'm doing it. So when I'm doing every asana pose, my breathing is totally effortless, breathing out longer than breathing in. Another very important is breathing out is parasympathetic and breathing in is sympathetic. So having a proper parasympathetic activation brings a relaxation response. My whole wrist comes down and I'm in a profound level of relaxation. Very powerful tool. You need to practice all the time. Shoulder get relaxed with a rotation because shoulder is a ball and socket joint. But also in the meantime, what I'm doing, so I'm sitting down with a cross-legged. So what I'm doing, I put my feet under my knees and I'm comfortable. Suppose I have a pain here, what I do, I back off. But I stay in the posture, I do my breathing, do my relaxation, and slowly this thing takes place. Then I also create a balance. The whole yoga practice is a balance. A relaxation is a balance. So I will cross my feet, I will sit down, other way. And I always notice, and all of you will notice, your one side is easier than the other side, which is normal. So what you do, you try to stay in the posture which is a little more uncomfortable. So that is the shoulder, you put your hand in the shoulder and slowly try to bring your elbows together and listen to your body's signal. If you have a pain, you back off. If you don't have any pain, slowly bring it close together. And with the breathing, you breathe out first, take a deep breath in, and slowly rotate your shoulder with your exhalation. Do not hold your breath, and breath should be completely effortless. Breathe in, breathe out. Then you go ahead and start closing your eyes. Close your eyes and keep doing it with your breathing. You'll find a profound level of relaxation. And I always practice about it. Then I do the opposite. Breathe in, start the opposite side. You can watch me, my eyes are closed. I'm following my breath. And remember, when eyes are open, you get all the visual simulation that tightens you up. Pratyahara, pratyaha. Pratya means reject, ahar means input. You have five senses. I hear, I see, I smell, I taste, and I touch. I'm controlling all the five senses. I'm slowly entering into a state of meditation. Sixth limb is called dharan. Is that your focus? And the seventh limb is dhyan, meditation. Meditation is the seventh limb of yoga. And meditation at the limb where we call meditation is medication. Your body starts creating any medication you can think about, and we call it your medicine cabinet of your mind. Now, I'm very relaxed. What I do, I go to the next step. Generally, I take one foot in the top and try to put it here. It's called a Ardha Padmasana or Swastikasana. I'm having pain. So what I do, I back off. I back off here slowly. Even at pain, I back off here. Even I back off here. But it starts somewhere. But I'm comfortable enough, I can put it here. Another thing I do, if you notice it, which I've been doing completely unconsciously, is I'm touching the tip of my fingers like this every time I was talking to you. And this happened, it became so effortless for me. It's called Hagini Mudra. Hagini Mudra brings a focus of your mind. So what I'm doing, what I'm talking, I'm teaching, I'm properly in focus. Then your mind, as I said, the mind needs to quiet down during your practice, and mind needs to quiet down during this environment which you are in now. Anxiety, when you're anxious, you do according your Shankha Mudra. 2 hands, take your right hand, wrap around your left thumb, take the left hand, wrap around your right hand, touch your index finger and thumb. This looks like a conch shell, Shankha Mudra. This is to reduce your anxiety and tension. Always balance it to the opposite side. Use your left hand to wrap around your thumb, right hand to wrap around your left hand, touch your index finger and thumb. And many a time I close my eyes and sit down. I do a practice with this. My mind is quiet. I'm in a profound level of relaxation. Keeping the balance is called a Dhenu Mudra. I'm still right-handed, right-footed. My left brain is active. My right brain is not working properly. So I'm trying to activate. So have your both the hand touch the opposite finger, like right index finger touching my left middle finger, right middle finger touching the left index finger, the left little finger touching my right ring finger, and right little finger touching the left ring finger, thumb but touching. This is called the Dhenu Mudra. And this is called actually Adar of Ka. It connects your both sides of the brain. So when you are a little comfortable and relaxed, you can even do this. All the mudras, even closing your eyes. Like my eyes are closed and you can see I'm touching my right index finger to the left middle finger, right middle finger to the left index finger, right ring finger to the left little finger, and right little finger to the left ring finger. This shows that your body and mind is connected. It's exactly same assessing your subtle body. My subtle body is the body of my mind. My eyes are closed. I can assess any part of my body. I can touch my tip of my nose. I can touch my left great toe. I can touch top of my head. I can touch my left knee. I don't need to look at them. That tells you the body and mind is connected. The most important part to relax is the neck. Neck is the most tightest part. This is called a Brahma Mudra. So Brahma Mudra is a 4 steps, and you do with your breathing and with your hand. Remember, hand is connected to your mind. Everybody, whenever you talk, you move your hands. You know, I've seen that people like a broadcast journalist, they put a microphone here, they're talking, and this hand is doing like this. This is a normal phenomenon. So use your hand. The most important relaxation is your Balamushti Mudra or a baby fist. Thumb inside and close and gently put over your knees. For the neck, you breathe out first. Take a deep breath in and slowly put your neck to the back. Always listen to your pain and effortless breathing. Then breathing out, slowly drop your head in the front and listen to your body signal. No pain and effortless breathing. Slowly do it a few more times. Breathe in, breathe out. Breathe in, breathe out. At home, when you do it a few more times. Here we are showing you the 4 steps of Brahma Mudra. That always with your breathing and breathing out longer than breathing in. My eyes are closed. Second step, breathe out first. Take a deep breath in. Drop your neck to one side. At the same breathing cycle, bring it in the middle. Again, breathe in the middle. Drop your neck to the opposite side. And again, bring it in the middle. Couple of more times. Breathe in the middle. And the breathing out. Dropping down on the other side. And the same breathing cycle, you come back in the middle. Do not hold your breath. Do not have any interruption in your breathing. Breathe in the middle. And slowly you can see my inhalation becoming longer and longer. Generally, we start count of 2 in, count of 4 out, count of 3 in, count of 6 out, count of 4 in, count of 8 out. We almost can do count of 10 in and count of 20 out. Third step, breathe out first. Take a deep breath in. Slowly turn your neck to one side, looking all the way to the back. And same breathing cycle, come back in the middle. Breathe in the middle. Breathe out all the way to the back without turning your shoulder. Do it a few more times. Breathe in the middle. Breathe out all the way to the back. Coming back in the middle. You should be able to hear the whole breathing, what I'm doing with my practice. Finally, drop your head down. This is the fourth step. Breathe out first. Take a deep breath in. Slowly turn your neck to the left, to the back, to the right, and in the front. Breathe in again and breathe out. Do it opposite side. Breathe in. Start the opposite side. To the right, to the back, to the left, and in the front. Breathe in. Breathe out. It's a powerful technique. You're able to relax your neck, your whole body gets relaxed. Back pain is due to tightness. All the pain in the body is due to tightness. So I'm relaxed enough. I can go ahead and balance myself. Now slowly I can put my other foot on the top. This is also called Ardha Padmasana or Swastika Asana. But I listen to my body's signal. If I get a pain, I will back off. If I get any breathing difficulties, if my breathing is not effortless, I will back off. So very important. So the chronic pain, we all senior citizens get a chronic pain. And the chronic pain is due to tightness. You know, your joint has arthritis, your cartilage is gone, broken down, but cartilage doesn't have any pain fiber. The rubbing doesn't cause pain. When there is inflammation, the rubbing, body tries to do your splinting, because that's the body's way of trying to control that rubbing. So the tightness of the ligament, tightness of the muscle, and all the pain fibers are in the ligament and the muscle. So able to relax your ligaments and the muscle relieves your pain. So a relaxation response of your asana practice is a therapy for chronic pain. So if you look at me now, I'm relaxed enough. So what I can do, I can take my other foot on the top and put it here and sit down in what's called a lotus posture, called a Padmasana. This is a very relaxing asana. You can see how relaxed it is. Another thing I do, your feet get relaxed when you're able to separate your toes. When I sit down, I generally take my one hand, I'll take my fingers, I put in between my toes. Initially, it's very tight, it doesn't go through, but when I'm relaxed, look at that, it just goes in and out without any effort at all. I'll be using my other hand, take a look how beautifully I do. Take my one hand, it just goes in and out. If I feel anything, say I'm feeling maybe, so to give an example, I may be feeling some pain. So what I will do, I'll back off. I will back off, in fact, I'll back off here and stay in the posture until that relaxation is setting in. In fact, I will put in a posture, in an asana pose where I'm comfortable. There is no named asana. All the asanas are for your relaxation. And all the asanas are not that you want to do it. All the asanas are let go. If you let go, every asana will come to you. Whole upper body get relaxed. It's called Paschim Namaskar, prayer pose to the back. So we do a prayer pose like that, in the hand in the front. Yogis will do prayer pose to the back. And let me show you how to do the prayer pose to the back. So here I am. Hopefully you can see me now. My hand goes to the back. Slowly I put it in a prayer pose. And the prayer pose sets in. And slowly, I can put my hand high up. 1 week, 2 weeks, 6 weeks. Sometimes it takes about 30 to 40 inputs to create a phenomenon called neuroplasticity. Neuroplasticity basically is a habit forming. So you can see my whole body, whole upper part of the body is completely relaxed. Now I'm breathing in, I'm breathing out first, I'm breathing in. I'm breathing in almost 2 or 3 times more than what normally is my tidal volume or my normal breathing in capacity. Very powerful yogic tool, and you practice it all the time. So see how simple it is. I'm doing my prayer pose to the back, have my eyes closed, I'm breathing. I can see able to remove those residual air in the lung is a lung health. That is improving your lung health, because that's a toxin sitting in the lung. And by able to do a gentle pranayama, people ask me how to do pranayama. Pranayama. Prana is a life force, subtle energy. It keeps you awake, alert, and alive. Breath is not the prana. Breath is the carrier of prana. Metaphorically, prana is like electricity and breath is like electric cable. It is carrying the prana to your body for proper healing. It's called a pranic healing. Yama, control and restrain. You are literally controlling and restraining your prana to be able to control and restraining your breath. So the basic pranayama is effortless breathing, breathing out longer than breathing in. Next pranayamas will be in stages. The Bastrika, bellows. Bellows are active inhalation, active exhalation, able to remove all the toxic carbon dioxide from the lung and able to bring more oxygen in. For the coronavirus, since there is a component of pulmonary fibrosis, we learn breath holding. It's called kumbhaka. We do two breath holding. It's called breath holding in inhalation, abhantarin kumbhak, and breath holding in exhalation, called a bhajya kumbhak. And with those breath holding, we also incorporate a body locks called the bandhas. With the abhantarin kumbhak, like we call it your breath holding in inhalation, we incorporate what is called a chin lock. We keep our body straight, do not bend your neck, slowly drop your chin down and try to touch your chin to the chest. This is called a chin lock. It has a profound physiological effect. It stimulates the two sides of the neck called carotid sinus. It quiets down your cardiovascular system, nervous system, and has a profound physiological effect. So breath holding in inhalation and incorporating the chin lock is called a murcha pranayama. Murcha basically means unconscious. You are in a state, almost in a level of unconscious, that means you are completely relaxed. Breath holding in exhalation, we will do it, you'll see. We incorporate an abdominal lock called Uddiyani Bandh. Uddiyani Bandh, and also we incorporate a little bit of called a root lock, Mula Bandh. We use all the three locks, chin lock, abdominal lock, and a root lock. Jalandhar Bandha, Uddiyani Bandha, and the three bandhas together is called Great Lock, Mahabandha. We'll be doing Kapalbhati Pranayama, which is going against the grain of your habit. Normally, inhalation is active, exhalation is passive. Here it will be, exhalation will be active, inhalation will be passive, and removing all the toxins. Alternate nostril breathing, Anulom Vilom Pranayama, very important to activate both sides of the brain and to improve your pulmonary function. Bhramri Pranayam, bumblebee breathing, quiets down your mind, and it really removes all the tension and anxiety from your mind. Ujjayi Pranayam, it's a victorious. It shows that you're able to constrict your larynx in a completely relaxed way, able to breathe in, activating your superior and inferior laryngeal nerve, which is a vagus nerve. Vagus nerve carrying the signal is 80% is the input, and bringing the signal out to the cranial nerve, having an effect on your glossopharyngeal nerve and hypoglossal nerve. Glossopharyngeal nerve tightening the muscles of the softer palate, removing your snoring, and able to push the tongue in front, almost curing your sleep apnea. Your pulmonary function gets better and better. So these are the practices we'll do slowly. But before that, let's do a little bit more relaxation of the lower part of the body. Say from the whole in the back and upper part. It's called Yoga Mudra. You hold your left hand to the back. Breathe out first. Take a deep breath in. And slowly drop your head down. See how far you can come down. And listen to your body signal. What is your body signal? First one was pain. So there is no pain, you're able to come down more and more. There is effortless breathing. If your breathing is effortless, if you have no pain, you stay in the posture within 5 to 10 breaths and practice breathing out longer than breathing in. And then you slowly get up one step at a time. How do we know the effect of this practice? We have this. Most of you have know what this is. Apple Watch. It's recording all my vital functions, recording in a continuous EKG, my heart rate, all my functions. So I can see the effect of all this in the vital functions of my body. So I'm a physician, we're coming from a medical background, and I can bring the whole physiological changes in the body and mind, what it's doing to you. Let's do the little lower part. In the lower part, always remember the first relaxation practice is able to keep your spine straight. Why? Because my skeleton is going to fall in front. So all the muscles in my back, or paraspinal muscle, is contracting to keep my skeleton straight. So when I feel it, I feel like 2 pieces of brick sitting here. But by the time I keep my spine straight, I always, sitting down in the ground, my spine is straight. I sit in a chair, my spine is straight. I'm driving my car, I keep my spine straight. I'm eating my dinner with a knife and fork, my spine is straight. When the spine I keep straight, the muscle gets a relief, and slowly I feel like 2 pieces of pillows sitting here. So by the time you incorporate your spine straight, you feel a relaxation. And also you notice I'm not doing a sudden movement. I'm taking my time. I'm slowly putting my left foot in the front. I'm taking my other foot and I'm waiting. I'm doing this to show you that more slowly and slowly you do it, better and relaxation will achieve. Remember, in an exercise is a muscle contraction. It is sympathetic response. It is your heart rate goes up, blood pressure goes up, respiratory rate goes up. It's a sympathetic response. When a sympathetic response, you get more, is called sympathetic overdrive. Your body starts activating a parasympathetic tone. Very important phenomenon. But in a yoga practice, it's called a let go. It's a let go and not doing. You're not doing anything. You're listening to your body signal. Separation of your toes. If you can separate your toes and breathe in and breathe out, breathe in and breathe out, you feel very comfortable. Your feet get relaxed. Market is full of it. You have yoga toes, yoga socks, yoga shoes, but all are there to separate your toes. Ankle is very important. Do with your relaxation with the breathing. Breathe in, you bring the ankle towards your knees, breathe out, slowly put it towards the ground. I think I have a hard time seeing, but if I can show it to you, breathe in, breathe out. Breathe in, breathe out. Out of your camera range, but that's okay. Slowly you can rotate your ankle. Relaxation of the knees and hips are very important. So, like I'm holding one of my foot, I'm bringing it high up here. I use my hand, put my fingers in between toes. I'm in a profound level of relaxation. Knee is a site of fear and hip is a site of emotion. Okay? Able to relax, you control your fear and emotion. So bring your whole hip joint high up. Take a breathe out first. Take a deep breath in and slowly drop it down. Breathe in, breathe out. Breathe in, breathe out. If it doesn't go down, don't push it down. If you push it down, it's going to come back high up. If it stays high up here, close your eyes, do your breathing, breathing out longer than breathing in, and slowly it will go down. We know it will go down because why? It happened to us. You know, we're like a stick. Our body, I was a surgeon, I was operating. My whole awareness was an operating field. My whole back, lumbar area, cervical area was like a completely, almost like a frozen. But able to relax, everything is relaxed. You name asana, I can do it. That's why it's called let go. Left hand is here. Hold your knee way high up here. This is your baby. Yeah, just give a little hug to the baby. Breathe out first. Deep breath in. Slowly drop it down. And it will come down on its own. You don't have to do anything. You don't have to push, do nothing. You breathe in. Out. At the time this thing happens, you are in a profound level of relaxation. Your breathing gets better and better. Hip joint get relaxed, we call your Titliyasana or Baddha Konasana. Take your both the feet, put it together, slowly bring close to you. Put your clasped hand underneath, and both the hips are slowly going to go down. And no rush, just slowly. Keep your eyes closed, keep your spine straight, and you will see your hip joint will get relaxed. Hip joint is side of emotion, and all the emotions are going on today with the coronavirus. You will be able to control your emotion. One of the disease which causes from the emotion is a hypertension. The hypertension will get better and better. And a total body relaxation. We show it to all the time. This is called your squatting pose, Malasana. If you're able to sit down in a squatting pose, look at how relaxing it is. Your ankle is relaxed, knees are relaxed, your hip is relaxed. Then you put your hand, separate your fingers get relaxed. You extend your wrist and slowly put your one elbow inside, other elbow inside, and keep your spine straight and bring your whole body in a completely relaxed asana. Eyes are closed. You are breathing in and out. And you can see the difference of your breathing in and breathing out. If you're able to breathe in like a 3-second in, 6-second out, with this posture, you'll be able to breathe in maybe about 4-second in, 8-second out, 6-second in, 12-second out. You can do almost a 10-second in, 20-second out. Very, very important yogic practice. So once you're relaxed and your muscles of respiration, remember muscles of respiration is always connected with your hand. So if you do a little bit of a hand strength, that also helps you in your breathing and improving your lung function. So a lot of asanas you can do for improving your hand strength and hand balance. One of them is your simple, very simple, it's called your bakasana or crow. You can put your hands here. It's hard to show, and it's very easy to show when you're in public. You push your hands down, you don't do anything else. Slowly put your body high up, and your feet is going to go high up, and it's going to stay high up. Bakasana. It shows the balance and strength of your hand, but gives you a better breathing performance. Why? Because these skeletal muscles are trainable. You know, like your skeletal muscle, like your biceps. If you're doing a weight training, you get a 5 pounds, and after a few weeks, you get a 10 pounds, you get a 15 pounds, even 20 pounds. You can always train. So the skeletal muscle, you can train your breath. And when you train your breath, your breathing gets better and better. And when you can inhale about say count of 10 in and count of 20 out, and you'll be able to do it throughout the whole day, your brain gets a signal which is called neuroplasticity. Neuroplasticity basically means habit forming. You'll be able to do all the time. And that is a powerful tool to improve lung health and improve fighting against any respiratory viruses like a coronavirus. Now, the first breathing technique is able to remove all the toxins you have in your lung and create more space. So what is the first practice? It's called your Bastrika, bellows. Bellows is you use for your fireplaces. Bellows you use for your, like a blacksmith. So bellows, if you can see how to do it, you can put your hand first. Bellows will inhale, active inhalation, active exhalation, like this. You will have some mucus will drain out, especially if you're doing, jalneti. If you use a neti pot in jalneti, you'll have some drainage will come out, but which is entirely normal. And you want that. So we keep a box of Kleenex all the time for you. And you can do again the same in all the various asana postures. Like you can do it like putting your hands outside, like a breathing. Do with your eyes closed, you feel the effect of it in your body and mind. It's a powerful tool. In fact, we also do a chest opening. We also do this, forward bending. We do this thing with the sit-ups, all with your called Bastrika Pranayama. So asana practice with a Bastrika Pranayama. Another simplest way to do with your hand raising. And in a hand, remember the relaxation is your Balo Mushti Mudra. the baby fist. So when you do it, you can raise your hand high up, breathe out first, take a deep breath in, and when you pull it down with the baby fist. You still will have some drainage coming out. It's entirely normal. And you can progress a little bit more, do a little faster and faster. In fact, in yoga therapy, which is based on the imbalance of your body's doshas, like body's energy types, called Vat, Pitta and Kapha, Vata, Pitta and Kapha, you will see that people with the Vata who are mobile will do a very slow Bhastrika Pranayama, and people with the Kapha will do a very rapid Bhastrika Pranayama. So let's do a cycle of 10 slow Bhastrika, 10 medium, and 10 rapid. Will be one cycle. We'll be doing 2 cycles of it. If you can continue with us, you'll continue. If not, you stop, close your eyes, and do the breathing out longer than breathing in. This is a very powerful practice to improve your lung health. Slow 10 with the eyes closed. Medium. Rapid. Slow 10. Medium. Rapid. Powerful practice. It removes all the toxins in your lung, created a tremendous amount of space, and now if you can breathe in and out, you can breathe about 2, 3, 4, 5 times more than what is a normal breathing. This was my breathing in, almost count of 10. Breathing out. Next, for coronavirus, we'll be suggesting you to practice breath holding. Remember, breath holding, if you do with an effort, it becomes sympathetic. You also have to do breath holding totally effortless. When you do effortless breath holding, you can, through the practice, you can increase the timing slowly and slowly. So again, have a relaxation practice. Another concentration is called a Dhyana Mudra or a Jnana Mudra. So meditation mudra, touching index finger and a thumb. This is the Ayurvedic concept of Pancha Mahabhuta, 5 elements: space, air, fire, water, earth. Space is the middle finger, air is in the index finger, fire is your thumb, water is your little finger, earth is your ring finger. Able to quiet down your air element with the fire element, totally quiets down your mind. This is called Mursha Pranayam. Mursha, like almost unconscious, proper relaxation, very powerful tool for improve pulmonary health. So breathe out first. Take a deep breath in. Hold your breath and slowly drop your chin down. Bring your chin close to your chest. Hold your breath and keep counting. How long you can hold your breath. Counting will be very easy, like 1 and 2 and 3, to see how long you can hold your breath. Normally 20 seconds is a very good time. Slowly practice, it will go up to 40 seconds, 45 seconds. For a good yogi, it will be almost a minute. And for a long-term yoga practitioner, it can be 1.5 minutes, almost 2 minutes. World record is for the people who do the scuba diving, almost 7-8 minutes. Let's try one more time. All yogic practice, breathe out first. Take a deep breath in. Hold your breath. Drop your chin down, chin to the chest, and hold your breath as long as you can. Even for people with the coronavirus, they can always test the breath holding power. If for average person, they can hold the breath in inhalation over 10 seconds to 15 seconds, they have a very good exchange. Remember, there is no sign of any pulmonary fibrosis. Breath holding and exhalation is another very important Again, my hand is in a Dhyana Mudra or a Jnana Mudra. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. So notice that. Breathing out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. Excuse me. So this was breath holding in exhalation and pushing the abdominal wall in. It creates a more negative intra-abdominal pressure with a proper perfusion of your internal organs. Very good practice. It also reduces the negative intra-abdominal pressure. We also recommend that people who have a hernia practice that so that there is no positive pressure pushing the content out. One more time, breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. Another lock is called a root lock, Mula Bandh, and all three together is called your Mahabandh. Mula Bandh is again breathing out first, take a deep breath in, breathe out, hold your breath, pull your whole pelvic floor and pull it up and hold. It's like a Kegel maneuver. Very good for women with a pelvic wall problem, women with a little prolapse, stress incontinence, very, very functional and physiological practice. You can do all the three locks together. It's called the great lock or Mahabandh. Touch your index finger and thumb. Breathe out first. Take a deep breath in. Completely breathe out. Pull your pelvic floor up and hold. Suck your stomach in. Then slowly drop your chin down, touch your chin to the chest. To stay in the posture as long as you can. Mahabandh, and according to yogic practice, this is one of the practice no yogis leave home without doing it. This is a practice I do every single day. This is a practice to improve your body's immunity, body's health and healing, to fight any external viruses or pathogens. So there are two kinds of disease, exogenous disease and endogenous disease. Exogenous disease, which is coming from outside, bacteria, and a virus, and an allergen, dust, mold, you can name it. And endogenous disease, the disease coming from inside, like your diabetes, hypertension, heart disease. And so coronavirus is an exogenous disease, and it's very important that you practice the locks. Kapalbhati pranayam. Kapal is a forehead, Bhati is a shine. Kapalbhati pranayama is completely opposite of normal breathing, going against the grain of your habit, like your active exhalation, passive inhalation. So the way you to do it first is that you are again touching your index finger and thumb. You're completely relaxed. You have a balloon here, you have a diaphragm here, another balloon here. So you push your belly button to the back and then it will hit your diaphragm, then it will hit your that's balloon, the lung, and all the air will come out. So again, touch your index finger and thumb, and then push your belly button to the back. Okay, just I'll be back in a minute. Hello. Sound এত সাউন্ড করি। Okay, I'm back. So we're doing a Kapalbhati Pranayama. Okay, always remember, you always get some drainage coming out when you were doing a pranayama practice. So in a Kapalbhati Pranayama, you again touch your index finger and thumb and push your belly button to the back. It hits your diaphragm and the air comes out. If you're new to the practice, you can put your one hand in the belly button and then you push it back in, you'll see air comes out. So generally the practice we do, we generally put it with your mudras. This is called a Gyana mudra, quite start your mind. Then you can put index finger down, this is called a Vayu mudra. It controls your pain, controls your vata. Touch your middle finger and thumb, this is called a Shunya mudra, improves your hearing. Touch your ring finger and thumb, this is called Prithvi mudra, very good for obesity, diabetes. Little finger and thumb called Varun mudra. It improves your bladder function, controls your body fluid. Ring finger, little finger and thumb called Shakti mudra, improves your strength. Very good practice. Touch your middle finger, ring finger and thumb. This is called an Apna mudra. Apna mudra is called a Pachan mudra. It is basically a cleansing mudra. When you put your index finger down, this is called your Apna Vayu mudra. Apna Vayu mudra is very good for cardiopulmonary function. So the practice is, when you do the pranayama practice, you also do mudras. So pranayama quiets down your mind, because the breath is a connector between your body and mind, and the hand is a connector to your body and mind. It's a synergistic or your combination effect. Generally what I do every mudra, I generally put maybe 50 to 100, because when I'm doing it for 25 minutes of pranayama, I do about 3 to 4 minutes of Bastrika, 5 to 10 minutes of your Kapalbhati Pranayama, 5 to 10 minutes of alternate nostril breathing, and Brahmari Pranayam and Ujjayi Pranayam. Also there is Sitali Pranayam, Sitkari Pranayam. But for the practice sake, let's go about maybe 15, 20 counts with each mudras and see how it does. I'm going to let you do the practice, and I'm going to explain to you the benefit of this pranayama. First, start with the Gyana mudra, Dhyana mudra. Index finger down, do your Vayu mudra. Keep doing it, let me tell you the benefit. Massages your internal organ. Massages your liver, massages your stomach, massages your spleen, massages your pancreas, massages your intestine. For female, it massages your ovaries, tubes, uterus. For men, it massages your prostate gland. Very important practice for women with infertile women. Keep continuing it, about 20 counts in each mudra. This is your called Shunya mudra, improves your hearing, and continue it. Also noticed when I am pushing my belly button back in, it hitting my diaphragm hitting my lung, and the air is coming out. Very simple way to practice is put your hand and it can come out. Between the lung is sitting your heart. Okay. Start the next one, called your Prithvi Mudra. So between the lung is the heart. So every time you're putting a stroke in your belly button to the back, you are gently massaging your heart. In yogic tradition, when you massage an organ, the organ gets better and better. So massaging the lung, massaging the heart internally, it is almost like your internal CPR, cardiopulmonary resuscitation. When somebody has a heart problem or heart stops, you do a chest compression, called external massaging of the heart. This is internal massaging of your lung and the heart, and will be a very powerful tool for people with cardiopulmonary problem and people who want to improve your lung function, especially in this day of coronavirus. You can do the little finger and thumb, about another 20 more counts. Very simple practice. You do the Shakti Mudra, ring finger, little finger and thumb. Apna Mudra, middle finger, ring finger and thumb. This is also called a Pachin Mudra, and this is also your removal of your toxins mudra. Another very powerful mudra is called a Linga Mudra. You put your hands all together, clasp it, and your thumb goes high up. This is to remove your phlegma. The children do all the time. The children have a little bit of a flame in the throat. They will do Linga Mudra. You can do it in both hands also, same way. Anulom Vilom Pranayama, alternate nostril breathing. Very important breathing technique because we are right-handed, right-footed, or left-handed, left-footed. We are lateralized. One side of our brain is working. In alternate nostril breathing, the left nostril is controlled by the right brain, right nostril is controlled by the left brain. And right brain is intuitive, right brain is female, right brain is cooling. So left nostril breathing is called cooling. Chandranari, Ida channel. Left brain is analytical, is heating, is male. So right nostril breathing is called sun energy, Surya energy, Pingala. It activates both sides of our brain. It balances the both sides. In yogic tradition, left side has a female energy, right side is a male energy. It balances the both energy of the body. It balances your vata, pitta, and kapha in your body. Very important breathing technique. So the way to do it, use your left hand, touch your index finger and thumb, put it gently over your knee. Use your right hand, use your right thumb to close your right nostril. You don't have to press it down, close hard, just close underneath the opening. And also, before that, what you can do, you can test which side is more open. We go through a cycle of every 90 minutes to 2 hours of regular alternate nostril breathing. Our nostril is always one is more open than the other, and it alternates. So if you want to practice it and see, first you close your right nostril, breathe in and out through your left nostril. Breathe out. Now you close your left nostril, just use your ring finger underneath your left nostril, breathe in and out through right nostril. I feel very open on both sides, but if you notice it, most of us will have one side is more open than the other side. And alternate nostril breathing brings that equal breathing on both sides. The right hand, closing my right nostril underneath. Through the left nostril, breathe out first. Then take a deep breath in. Drop your hand down. Close your left nostril with the ring finger and little finger and breathe out through your right nostril. Breathe in through your right nostril. Drop your right thumb down, close your right nostril and breathe out through your left nostril. Breathe in through your left nostril. Close your left nostril, breathe out through the right nostril. Now continue alternate nostril breathing. Then incorporate another focus. Take your index finger and middle finger, put it in between your third eye, in between your eyebrows and the third eye, and close your eyes and bring your concentration to the third eye. Now you do alternate nostril breathing with a complete eyes closed focus in between your eyebrows. Many a time you feel a little uncomfortable in this right hand. Many a time I put it over on a small table and continue it, and that takes out all the attention. Other time I can use my this hand to support this hand, and supporting and focusing, I continue alternate nostril breathing. So generally we continue for about as long as you can do without any effort, effortless breathing. For us, we've been doing it for so long, nothing is an effort for us. Continue between 5 to 10 minutes. This is one of the main pranayama to improve your balancing both sides and improving your immunity, basically bring a balance. Lack of immunity, autoimmune disease in yogic tradition is imbalance in the immune system. So when you bring the balancing poses, balancing breathing, alternate nostril breathing is very important to bring your immunity and improve your body's resistance power. When the yoga practice is effortless, we generally have no idea even how many times we are doing. We cannot even count. We're in a completely effortless ease. When body and mind is connected, as I'm noticing it to you, we can access our subtle body. We have three bodies in relation to your body, mind, and spirit, called gross body, subtle body, and causal body. Sthula Sharir, Shukha Sharir, and Karana Sharir. When you're able to access your subtle body is the body of your mind. Like your physical body is here, subtle body could be somewhere else, and you can always access that. So this is a very important, almost meditative alternate nostril breathing. We call it the alternate nostril breathing without closing your nostril. The moment to do it, I'm touching my index finger and thumb, putting it over both the knees. My eyes are closed and my concentration is on my breathing. Without closing my nostril and breathing out through my left nostril. And breathing in through the left nostril. Breathing out through the right nostril. Breathing in through right nostril. Breathing out through the left nostril. I can clearly see I'm breathing through the one nostril in. And breathing out through the other nostril. Just practice a few more times with your eyes closed, alternate nostril breathing mentally without closing your nostril. When you keep doing it, you have a profound level of relaxation, and it's a union of your body and mind, which is basically yoga. Yoga means union of your body and mind. Our five senses keeps us awake, alert, and very tight. Able to control your five senses, called pratyahara, pratyahar, rejection of your intakes. And our brain is in a state of vibration, the frequency. I create a frequency from outside. Two frequencies interact, cancels, it's called harmonic resonance. It's called Brahmari Pranayama. Bhramari Pranayam is ideal for the present situation of this panic and the fear and all these misinformations that social media is spreading. So the way to do it, I'm going to show it to you, then we'll do it together about 3 times together. Put your index finger on your forehead. Use your 3 fingers to close your eyes. Use your thumb to close your ear and close your mouth. Literally, I close my vision, my hearing, my smell, and my taste. I'll breathe out first, then I'll take a deep breath in. I'll breathe out with the sound of a bee. Let's do all together. We'll do it 3 times. Breathe out first. Take a deep breath in. Slowly take both the hands. Now we're humming and cupping. With both the hands, keep rubbing your hands, keep rubbing your hands, keep rubbing your hands really hard, really hard. When you feel the warmth of your hand, if you're wearing glasses, you remove your glasses, then take both the hands like a cupping, put it over your eyes, let the eyes take all the heat from your hand and massage your forehead, massage your eyes, massage your face and head and neck. It's a very powerful yogic relaxation. We'll finish with a little Jai Pranayam and also doing called a therapeutic meditation. Therapeutic meditation is your chakra awakening meditation. So what a chakra awakening meditation is that in the yogis, when they close their eyes, you have seen the color. There's a burst of color comes when you close your eyes. For the yogis, color they have was the color of the nature, color of the rainbow. Violet, indigo blue, green, yellow, orange, red. They assign those color along the line of the spine, and they started from the crown until the root of the spine. And they assigned a system of body's physiological system, body's functional system, your nervous plexuses, endocrine organs. But the way they have designed, like they put a violet is your crown chakra, indigo is a third eye chakra, blue is your throat chakra, Vishuddha chakra, green is your heart chakra, Anahata chakra, yellow is your solar plexus chakra, Manipur chakra, orange is your pelvic chakra, the Shadhisthana chakra, and red is your root chakra or your Muladhara chakra. Every chakra is connected with your system. The root Muladhara chakra is connected with your musculoskeletal system. So if you want to have a musculoskeletal disease, you practice on that chakra. And balancing sounds These are asanas, pranayamas, mudras, bandhas, but most important the sounds, the mantras for balancing: lam, vam, ram, yam, ham, sham, om. Pelvic chakra is connected to your reproductive system. Your Manipur chakra or your solar plexus chakra connected to gastrointestinal system. Your Anahata chakra or heart chakra connected to cardiovascular system. Your Vishuddha chakra or throat chakra connected to respiratory system. So for the coronavirus situation, we meditate more on Vishuddha chakra because it improves your pulmonary function. The Arka chakra, third eye chakra, is connected to your endocrine system, and your Shastra chakra or a crown chakra connected through your nervous system. So we'll do that, all the sounds, we'll practice together. But let's do some Ujjayi Pranayama. Ujjayi Pranayama is the able to tighten up your larynx and able to stimulate the laryngeal nerve or the vagus nerve. Remember, vagus nerve, 80% is the input. Afferent fibers, 20% is output. And vagus nerve fiber will bring your efferent fibers to the cranial nerves and also to your head and neck and throat area. It improves the function of the areas where the coronavirus is going to get in. So it will be removing your snoring, removing your sleep apnea. So the way to do it, again, get relaxed, use your Bala Mushti Mudra. Okay, breathe out first. Take a deep breath in. Completely breathe out. If you got a little cough, it's entirely normal because that's where the Ujjayi Pranayama originates from. Very relaxing pranayama. If you notice, when I'm doing Ujjayi Pranayama, I will also have a abdominal lock called Uddiyana Bandh. And this is a very advanced pranayama, but gives a profound physiological effect. So let me show you what I'm talking about. Again, breathe out first. Take a deep breath in. Completely breathe out. Sleep apnea is the root cause of metabolic syndrome. It acts through your limbic system, hypothalamus pituitary system. It causes truncal obesity, then it secretes pro-inflammatory molecules, creates diabetes, hypertension, dyslipidemia, and also it causes a reduction in your immune function. It's a very important practice to improve your immunity. Let's finish with the chakra awakening meditation. Touch your index finger and thumb. Close your eyes. Bring your awareness in the root of the spine. There's a wheel chakra, red in color, 4 petals, and it is an imbalance. Sound to balance it is a lump. So breathe out first. Take a deep breath in. Lam. Bring your awareness between belly button and the root of the spine. It's a pelvic chakra, Swadhisthana chakra, connecting to your reproductive system. It's an imbalance, and the sound to balance is the VUM, feel like a victory. So breathe out first. Take a deep breath in. VUM. Bring your awareness to your belly button. Yellow in color, 10 petals connected to your gastrointestinal system. Balancing this chakra is a drum or like a Robert. Breathe out first. A deep breath in. Ram. Bring your awareness towards your heart chakra. Color is green, connected to your cardiovascular system. And sound to balance the chakra is yam, while like a yellow. So breathe out first. Take a deep breath in. Yum. Bring your awareness to the throat chakra, Vishuddha chakra. Color is blue, 16 petals, connected to respiratory system, and the balancing sound is hum. Since we're talking about coronavirus and respiratory system, let's do meditation 3 times on this Vishuddha chakra. Breathe out first. Deep breath in. Bring your awareness in between the eyebrows, third eye chakra, Anka chakra. Color is indigo, connected to endocrine system, and the sound to balance this chakra is a sham, S-H. So breathe out first. Deep breath in. Sham. Bring your awareness to the crown of the head, crown chakra. Color is violet, 1,000 petals connected to nervous system. The balancing sound is Om. Yogic Om has a 3-component, A-U-M, A-U-Ma. A comes from the lower part of the lung, U comes from the middle part of the lung, Ma comes from the upper part of the lung. So breathe out first. Take a deep breath in. Slowly bring your hands in front of your chest. Touch the little finger and the thumb. Separate your ring finger, middle finger, and index finger. This is a Padma Mudra. The lotus mudra. It connects your body, mind, and spirit together. Heart is the site of your soul. Heart and mind is always connected. Bring the Padma Mudra close to your heart. We always say, memorize by heart. Heart and mind is connected. Slowly bring your hands together. Bring it in front of your heart. Pull your hands, head slowly, and you say, Namaste. Namaste is I honor the divinity within you. And this is a powerful gesture today in the coronavirus situation when we have a social distancing and no touch. Instead of a handshake, you do the Namaste. Finish again with a powerful yogic relaxation, pumping and cupping. Keep rubbing your hands, keep rubbing your hands, keep rubbing your hands. And you feel the warmth in your hand. Take your glasses off. Put your hands over your eyes like a cup. Let the eyes take all the heat from your hand. Massage your forehead. Massage your eyes. Massage your face and head and neck. It's a very powerful yogic practice. It's a very good practice. In fact, when I was doing this chakra awakening meditation, first thing happened, I had some saliva in my mouth. My mouth is still very wet. So when you have a sympathetic response, like when you are afraid, when you have a fear, you get a dry mouth. Dry mouth means that you have a sympathetic response. Parasympathetic response, you have saliva, because whole gastrointestinal tract, starting from the parotid gland all the way down, supplied by parasympathetic nerve. Parasympathetic nerve is called calm and digest. I could even feel, when I was touching the air, I could feel the deeper capillary pulses. Your awareness becomes so much for your body and mind. You can feel almost everything what is happening with your body and mind. Powerful practice. Practice every single day. Relaxation, breathing out longer than breathing in, breath holding, primarily for the coronavirus, and alternate nostril breathing, Kapalbhati Pranayama, Bhramri Pranayama, and Ujjayi Pranayama. beautiful practice. Thank you for joining us in this day of social distancing and self-quarantine. We'll probably will do a few more classes from home before we come out in public, especially when the health department and CDC will allow us to be in a public place. I see a lot of comments, a lot of people participating on this. So I will go ahead and take a look at them and answer them from my Facebook page. I'm going to finish it now. Thank you again.